Hello, everybody. Hello again. I am here present to tell you little talk. As we started some discussion about depression of kid, I just want to just tell something about it again a little bit to help the carer to increase awareness. It is so common nowadays to have depression in the children, and there are, I have discussed last time that so many symptoms you can see that can be related with that. So basically, a little bit different from adult. So basically, kids are more likely to experience irritability and physical complaints because it's a little bit their mental makeup is a little bit different from the adult. That is the reason. So I already mentioned about symptoms you have to look up for these is sadness, withdrawn from family friends, losing interest in activities, feeling misunderstood, academic decline, lack of energy, guilt, worthlessness, impulsivity, aggressions. Now, I'm just going to tell you about a little about causes. Depression is a complex condition. That is, many causes are there. A number of different factors that can contribute to the onset of depression in kids. Depression affects many children, and and of course, uh, Center of Disease Control and Prevention (CDC) reports 3.2% kids between 3 to 17 has been diagnosed with depression. Some of the risk factors that contribute, like brain chemistry imbalance in certain neurotransmitters like serotonin, dopamine, norepinephrine, can play a role. Environmental, chaotic, and unstable home life can be a risk factor for depression, and can experience social isolation and bullying in at school. Family history, of course, a family member and relatives have depression increase the risk of depressions of childs. And physical health conditions, particularly chronic illness, like sometimes the child when has chronic disease like type 1 diabetes, that also increases the risk of having depression. Stress, like moving, of course, from one place to another, or divorce of the parents, etc., can cause also depression. Now, how we can to help? If you think your child may be depressed, consult with, of course, GP and your healthcare professionals, and of course they will refer to maybe that according to the severity to whether to that needs to be going to the mental health professionals and rule out any medical cause that can cause that, and they give you that appropriate treatment. And of course, you have to monitor your child's mood symptoms like irritability, loss of pleasure, change of appetite, a change of sleep, tiredness, feeling of worthlessness, thought of death. If any serious signs are seen, then you have to talk about it with the healthcare professional. Provide reassurance. Let the child know depression is nothing to be ashamed of. It is endless like flu, and with treatment, it can get better. Provide repeated reassurance is very important. Encourage the child to talk. Give the child the right about to have this right to have this feeling, and can easily get the idea that it's not okay to feel depressed and start to hide their feeling. So it is not a healthy thing, and it have to make that it is okay if you are not feeling well, or something you're not feeling well. It is better to talk. And of course you have to teach the children how can they get help. Everywhere you can list of the people they can talk, may talk to yourself, that can be teacher or counselor, that will help. Never minimize feeling, and it may be small to you but it is a big things for them. So always take it very seriously, and watch your own behavior. So impact of your own response to life, that also how you coping, your coping skill, that is very important. That also have big impact on your child. So you have to learn those skills, or if you are not coping, you have to talk with healthcare professionals. So basically all these things, a little nutshells about the depression of carers. If feel that your child's in depression, so of course you can ask for help. Hope this little talk will help you to take help and to support your child if they are in depression. Thank you so much, and hopefully we'll next week again come with another little talk to help each other. Bye bye. Stay safe and healthy.